Could the gender of your doctor play a role in whether you get better faster? A new study out of the Harvard School of Public Health has determined that it might. Researchers examined both mortality and hospital readmission rates for a group of elderly patients and found that those treated by women doctors fared better. Previous studies have found that female physicians tend to stick more closely to clinical guidelines and are more likely to talk to their patients about preventative care. They also tend to be more communicative. But this is the first study that quantifies the impact of those approaches to medicine. Here to tell us more is one of the authors of the report, Dr. Ashish Jha. He's the director of the Harvard Global Health Institute at their School of Public Health, and Dr. Laura Burke, an ER physician at Beth Israel Deaconess. Thank you both for coming in. Laura, I want to start with you. I had not known until I read Ashish's study that it's common knowledge that women and men practice medicine differently. So my question for you is, at what point as a female physician do you become aware of these differences?
Well, I work with a lot of tremendous male colleagues, and I think we pay a bit more attention to this when we learn, both in reading studies and in hearing of our own experience and others, that there's a bit of a disparity for women, that there's a disparity in pay, that there's disparity in advancement. So a lot of us talk about differences in practice, and mostly we focused on feeling like we're doing just as good a job. But certainly I've noticed plenty of friends and colleagues who are women do a terrific job in communicating. They go the extra mile. I'd say that's true for male colleagues as well. But we've definitely noticed that there's significant differences in how we interact in general.
Did you, and then I'll go to Ashish, but did you start picking up on that as early as, say, med school? I mean, do you get a sense early on of the different ways that men and women comport themselves in a medical environment?
Again, there are some men who communicate more than others, and I didn't pay a particular attention to it along gender lines until later on, when a lot of us were discussing after training that perhaps we really need to show our worth, and we talked a lot about our value and our communicative styles with patients, and I think then is when I really noticed it. Okay.
Ashish, tell me what you ended up measuring to try to determine the outcome-based differences here, and what did you end up finding?
Yeah, so we have known about these differences in practice patterns, communication, and we wonder, does it really make a difference at the end of the day on the things that we care the most about? So what do we care about? Well, when people are hospitalized and we focus on the hospital, the thing you care most about is surviving the hospitalization, right? And then if you survive, not having to come back. So readmissions. So those were our two main outcomes, mortality and readmissions. And what we found was what I sort of describe as a modest but clinically important difference. So what does that mean? We found that women physicians, their patients are more likely to survive the hospitalization. And then if you look at everybody who lives through the end of hospitalization and goes home, patients of female physicians are less likely to have to come back within the first 30 days.
Now, to my non-statistician's eye, this was, as you say, a modest difference. Can you explain what it means that this is, in fact, clinically significant?
Sure. So we found about 0.5 percentage point difference in mortality. Here are a couple of ways of thinking about this. If men across America, male physicians across America, achieve the same outcomes that female physicians do, we'd have about 32,000 fewer deaths every year. That's about how many people die in motor vehicle accidents every year. So from a public health point of view, I'd say that's pretty important. Yeah. And if I had a drug, if I had a treatment that lowered mortality by 0.5 percentage point, it would get FDA approval, we'd use it widely. Nobody would say that's not important.
Is it possible that you would have found a different outcome if you'd scrutinized the results with a different group of patients, with younger patients, with patients who were, just younger patients, for example, patients who were in, say, an oncology unit, something like that? Or is this not linked to the specific population that you studied?
Right, so we focus on older Americans, people in the Medicare population. I actually am very confident that if we had looked at younger patients, the results would be very similar, and that's because there have been lots of studies that have looked at older populations. And basically, the way you treat a 70-year-old for pneumonia is basically how you treat a 50-year-old for pneumonia. So I don't think the age of the population is the big distinguishing feature here.
All right, I want to put you both on the spot together. As I understand it, the study did not identify why there is this difference in outcomes. It says there's a difference in approaches and there's a quantifiable difference in outcomes, but we can't say exactly what leads from one to the other. I'd love to get your take on what your ideas are about what that linkage might be, and then your take as well. And actually, either one of you should hop in. So I have to go Ashish and Laura. So what do you think, to your ear, as a physician who is a woman, why might outcomes be better when it comes to rehospitalization and mortality for patients who are treated by female physicians?
Maybe because we're trying our doubly hard to prove ourselves, that we're working just as hard to show our skill and expertise, and are paying particularly close attention, doing a good job communicating. Again, it's potentially part of the reason. Our life experiences also, I think, might allow us to really empathize for people who are caregivers, to really see the patient's entire situation beyond just the strict medical facts, might allow us to really get a broader view of the person.
I know I'm asking both of you to theorize about something, to speculate, and this is not a speculative study, but what do you think about the reasons that Laura suggested, and might there be others?
Yeah, no, so I think Laura's points are very much right on, that there is some reason, some evidence to believe that women communicate more effectively. They sort of see the picture a little bit differently. I try to sort of stick to the science on this, and the science on this is pretty...
I was afraid you were going to say that.
No, I'm sorry, but the science on this is pretty clear, right? That there are differences between men and women in terms of how we practice, and that the science says that women just tend to be a little bit more evidence-based, a little bit more effective on the communication. I'm guessing that's what explains the better outcomes.
Is there any convergence in the medical profession? If this knowledge has been there for so long, is there any attempt to, and the phrase I want to use is to feminize the way men practice medicine is probably the worst possible phrase. Is there any attempt to get male physicians to nudge them a little bit into doing the things that their female counterparts do more or better?
Well, I would say, look, I think the key on this study is that we got to figure out why it is that women are doing better. And we can speculate, and Laura's got her theories, I've got mine, but we really need to understand that better. And whatever those explanations are, we have to make sure everybody's doing them, men and women. So I think that's where we need to go next.
All right, and Laura, final question for you. When you and your female colleagues became aware of this study, which has gotten a ton of attention over the past couple of days, was there any sort of in private, high-fiving or smack-talking about your male peers?
Not smack-talking, but certainly just for us really appreciating the value that we provide, and especially in light of what we know there's been recent studies showing inequities. So really just proving our worth to medicine and really being recognized for the work that we do. I don't think anyone wants to say don't see a male doctor or to denigrate the work of our male colleagues.
I don't think you've said anything here that your male colleagues are going to take issue with, hopefully.
And but that I'm on a group of physician mothers on Facebook, and I was very quick to post it, and there have been a lot of reviews and women really appreciating that we're getting this recognition for the quality of care that we provide in medicine.
All right, Dr. Laura Burke, Dr. Ashish Jha, thank you both.
Thank you.
Thank you.